So I'm Kristy. I'm here today to talk to you about the PEG tube medication management and cleansing of a tube. Okay. Mary, good morning. How are you this morning? You slept well? That's wonderful. It's Kristy. I'm here to give you your medication this morning. I'm going to give you some Panadol that will help you with your pain and enable you to get up out of bed this morning. We'd have a look at her site, but it's important to use your hand hygiene at this point, and you'd use your alcohol-based rub for a good 20 seconds. Okay. Having a look at the site. Expose Mary, let her know constantly what you're up to. Mary, I'm just going to have a look at your site. Okay, some gloves. Okay, you can see that the tube has got some redness around it. That's normal as long as there's no hemosurus or infective ooze that's coming from the site. At this point, you want to make sure that the tube is free, can be rotated once. Okay. Position, where is the tube positioned? You can see that here it's located at 4 centimetres, and you would document that within your notes. When you crush your medications, it's important to make sure that your medications are able to be crushed within the drug guidelines. Panadol, Mary, is okay to be crushed, so we'll dilute that with 10 mils of water. And we want to make sure that that dilutes properly. If we don't, we run the risk of blocking our tube. Okay, we don't want that to happen, do we, Mary? Okay. Dissolve your medication, checking your chart, making sure your identifiers are all correct. And administering your medications according to the 7 rights. Okay. Purple syringe to purple tube. Mary, just giving you medication now. Okay, it's important upon administration of the medication to flush that tube, and we want to flush it with a good 20 mils of water. Okay, flushing of the tube. If we were to leave any medication within the tube, that runs a risk that it will block, and we don't want that to happen. That will cause discomfort to Mary, and it will also block the tube, and then you won't be able to use it. There is not best practice to use any cola or fizzy medication to actually unblock the tube, and bolus of water daily is recommended. Mary, in the shower today, are you able to give your area a wash? So for cleansing of the PEG tube in the shower, Mary can run some clean warm water over it, use a flannel either side. If Mary was unable to get into the shower and needed assistance, you would use a sterile pack and some normal saline. So opening the pack, attending to your aseptic technique. Clean. We want to go around the area to clean up any debris, food, inspect the site. Because there was some red around, we might put a trouser dressing on that wound. That stoma site, sorry. Cutting of the trouser legs, and we would just place this around the tube, which would give Mary some comfort. It would minimise the damage to any clothing. It would absorb some odours. We wouldn't want to tape that too heavily, Mary, because we don't want to not allow your area to breathe. At the same time, having a look, making sure that there's no pain on the site, doing a bit of inspection, asking Mary how's things going. She doesn't have any pain, any discomfort with that tube, ensuring that she covers up. An important point when you're giving medications through a PEG tube is that the bed is elevated to a 30-degree angle, and that assists to minimise any discomfort for Mary. Okay. Mary, I'm going to go. I'm going to get some towels and we'll come back and we'll give you a hand in the shower. Okay, good.